Hi, I'm Aarti Kumar, and I lead an organization called the Community Empowerment Lab that integrates cutting edge science with deep humanity and cultural wisdom to co create impactful solutions for helping babies and mothers survive and thrive, especially those in the most disadvantaged settings.
My leadership project is about birth, a rite of passage without which none of us would exist. I wonder what could be a more important existential problem for humans than to make this universal experience that sets the very foundation of our lives better and safer. Only a woman is endowed with the divine privilege to give birth to life, but unfortunately, universally, the real life birthing experience of women is nothing but divine. Data from a recent meta analysis of studies conducted in North India lays out a very dismal picture with unacceptable rates of disrespectful care, including verbal and physical abuse and threats. In my Karma Bhumi of Uttar Pradesh, despite concerted and intensive quality improvement efforts, we continue to see a persistence of harmful birthing practices across birthing centers. These include pre-delivery administration of uterotonics, inappropriate fundal pressure, etc., which, by the way, are not just prevalent in UP, they are widely prevalent across South Asia. Many of these practices contribute to poor birth outcomes, including the biggest killers, birth asphyxia in newborns and postpartum hemorrhage in mothers. My leadership project seeks to understand what makes these practices so persistent and to co-design strategies to modify them. To do this, my team spent days and nights living in birthing centers to deep dive into the context, environment, and worldviews shaping these practices. One doesn't need 6 by 6 vision to observe that a labor room in a community health center is starkly different from the one in the home. The health center labor room is much better equipped, but it is alien to mothers who deliver in an uncomfortable position lying halfway down these high and narrow labor tables. Thanks to progressive government policies, however, she is allowed a birth companion from her family. In contrast, at home, she is able to deliver in a familiar and comfortable environment in the position that she wishes and being around multiple known women who care for her. But these two settings have surprising similarities. When we see the people in the labor room and their mindsets, the differences between these two settings dissolve. In the health center labor room, the birth is partly attended by the nurse, partly by the ward ayah, and in some cases even the asha, with the birth companion providing support. The skills of dyes are highly valued even today. Interestingly, most nurses have learned how to conduct births from the experienced ward ayahs or dyes when they joined. Only after attending to thousands of births have they got exposed to quality improvement programs like Dakshata and nurse mentoring. So we see that the scene has shifted, but the dominant worldview governing the birthing process is still based on the community worldview. We tried to understand this community worldview that is at play in shaping birthing practices, and it centers around labor pain. Labor pain is understood as the essential driving force that pushes the baby out, but it is also the worst pain a mother will ever experience. Not all mothers can bear the pain, and even those who can bear it may not be able to last their energies till the end if the labor takes too long. But there is no guarantee for how long the labor will last. This is the biggest risk for both the mother and the baby. The labor itself is a valley of fire, and on the other side of it is success. There's a widespread belief that active intervention is needed to get to the other side of the pain, since the sooner the mother crosses this valley of fire, the better off she and her baby are. So these practices that we see on the surface, including disrespectful care, are active interventions that are intended to help the mother get to the other side of pain as quickly as possible. Current efforts to address these practices target them as individual practices but fail to recognize that their common source is a deep and universal belief and worldview. The engagement with nurses through the various quality improvement programs fails to acknowledge or even elicit their worldview and forces them to accept an alien worldview, which to us is scientific, but to them does not make any sense at all. So they do as they are expected to, under observation, but completely throw these alien instructions out of the window when they have the freedom. Our next steps are all about packaging the science in a way that speaks to their current worldview, delivering it, and measuring the change. But for that, we will need to establish a trustful engagement with all of these players in the facility and community settings and co-develop a path forward that will hopefully contribute to sustained changes in these practices. This work is not mine alone. I would like to acknowledge the extraordinary efforts of my stellar team of scuba divers.
Finally, I would like to express my deepest gratitude to the entire WomenLift Health team, my coach Meghna Srivastav, mentor Pritha Venkatachalam, and my amazing cohort of leaders who have become friends for life. WomenLift Health has helped me deep dive into my own self and identify levers for change that can help me become a more effective leader. Thank you.